Hello, everyone, and welcome back to Psychedelic Vantage. Today, I'm going to be doing a quick overview and sharing my thoughts as well about Compass Pathways' third quarter 2024 financial results and business updates. At the time of this recording, it is October 31st, 2024, the day that this press release came out. I'm sure a lot of people who follow this channel have already heard about the news. The data for COMP005 is getting pushed back a bit, and COMP006 data is getting pushed back pretty significantly, by a year, actually. And we'll go into some of the reasons behind this. Before I get this started, I would like to say I do not hold shares in Compass Pathways. I hold shares in Atai and Cybin. Nothing I say in this video is financial advice. This is all just my personal takes and opinions. So without further ado, actually, one more thing. Another thing I'd like to say is that we should all keep in mind that Compass Pathways is the first company to ever do these large, well-conducted phase 3 trials in the psychedelic medicine space. So we should keep that in mind when we are looking at what's going on. I personally am not too shocked that stuff is getting pushed back. A couple years ago when I first started investing in drug development companies in the neuropsychiatry space, learning more about that, close family friend told me that this is the stuff like these types of news releases are not uncommon at all. And drug development is measured, drug development success is measured in years, not weeks and months. And we've seen that in the psychedelic medicine spaces. It's certainly no exception. So let's get into it. Top line COMP005 data for COMP360, psilocybin, phase 3 in treatment-resistant depression. That pivotal program in treatment-resistant depression is now expected in the second quarter of 2025. Viewers might recall that, I guess, around a year ago, we had been expecting COMP005 data in the summer. And obviously, it's gotten pushed back. The team at Compass previously shared again today about the challenges associated with documentation of trial participants with treatment-resistant depression. Finding that documentation specifically in the U.S. has been difficult with the record keeping here in the U.S. They have to look for people who have failed 2 or more, I believe, pharmacological interventions in the current depressive episode. And maybe I'll speak a little bit later about maybe some of the advantages of working with an MDD population later on with Cybin. But nevertheless, this is very important to be looking at treatment-resistant depression. These treatments will, due to SSRIs being very cheap, generic, they work for around, depending on the data you look at, 30 to 50% of people on the first attempt, I guess, at treatment. It works for them. So these treatments will not be frontline for quite some time, and we should keep that in mind. I'm not saying whether I agree with that or not, and I'm also not a medical doctor, so I can't say whether that's right or not. We all have our own opinions about this. Anyways, COMP005 is 25 milligrams versus placebo, 0 milligrams. In this trial, the primary endpoint is at 6 weeks after 1 dose. And there's also the option for retreatment in a blinded fashion from week 6, after week 6 until week 26. And then there's an open label Part C extension from week 26 to 52. So it's exciting because we're going to get a lot of data on redosing. That's super important, very important data for us to gather. We saw that data was lacking in the Lykos phase 3 program, for example. So Yeah, COMP005, that data is pushed back into the second quarter of 2025. COMP006 data, this is the 3-arm study that will hopefully address some issues with expectancy. So 1 milligrams, 10 milligrams, 25 milligrams. People are also going to be looking at the difference between the 25 and the 10 milligram dose as well, because the argument, I guess, is if someone gets, with all this talk about functional unblinding, if someone gets the 10 milligram dose, they know they got it the vast majority of the time. Same with 25 milligrams. Yet, at least what we saw in the phase 2B, the 25 milligram group performed much better. But the primary endpoint in this trial will be 25 milligrams versus the 1, from my knowledge. Anyways, another differentiator of COMP006 is there's 2 doses before the primary endpoint at 6 weeks, which is I'm very excited about, especially after seeing the data that Cybin released and a lot of the promising early academic trials looking at psilocybin showed great results with 2 doses. But we'll have to wait for the data for the Cybin data was a small sample size, nevertheless exciting, but COMP006, I believe there's around 580 patients or so, trial participants in that trial. So these are big, these are big boy readouts. So I guess the big news here is the data will be announced after the 26-week time point, which is part of the reason why it's that this is basically, this was supposed to read out in the second half of 2025. Now it's going to be the second half of 2026. So the reason why they're going to wait till after the 26-week time point is because, think about it. If you release the 6-week data while the blinded portion of the trial is still going, that can have an effect on expectancy in the trial if trial participants see the data that was released. That's my understanding. So this makes a lot of sense. I think it's a smart move from Compass. Obviously, I don't even need to say that. They know what they're doing. They're Compass Pathways. Another reason it's getting pushed back is because the COMP005 trial sites are going to roll over into COMP006. And due to the fact that COMP005 is behind schedule, that has an effect on this trial as well. I guess, I'll just quickly say that I don't, this isn't the end of the world. Certainly this is not positive news, though. Another thing that I'm thinking about is, I think this affects Compass Pathways, their funding timeline. And, they may have to do another raise to get comfortably through these trials, and then maybe definitely another raise for commercialization unless they partner up. Dilution is mostly inevitable unless you find a partnership. You just hope, I guess, as an investor, that the dilution happens at a somewhat reasonable valuation. And we haven't seen that with the past couple of raises, in my opinion. A lot of dilution. So it's been a little bit frustrating, but that's the point where we are at right now. So yeah, data in the second half of 2026, strategic reorganization to focus all efforts on COMP360 program, resulting in reduction of workforce of approximately 30%. That's going to get their cash burn down, preserve capital, focus on their lead and most important asset in their pipeline, probably, definitely COMP360. There's going to be a pause on the preclinical work that's being done with their new chemical entities, and also their digital therapeutics. Based on the earnings call, my understanding is that they're going to try to externalize that, maybe sell the IP to a separate company. I think they're still going to be able to benefit off of this, but I don't know if it's going to be proprietary anymore to Compass. That was my interpretation of the earnings call. Cash position of $207 million sounds like a lot, but it's not too much money considering they're deep into phase 3 and data is getting pushed back now. Overall, even though I don't hold Compass, this is frustrating. in general, I want to see these treatments get into the medical world as FDA approved treatments, as soon as possible. Um, and also in terms of these stocks, I think that the Compass data coming out sooner would have been better for all, would have been great for all these other companies, except maybe GH Research. That thing moves on its own, as some people might realize. Not a lot of volume trading on that stock, which is very interesting to me. A lot of institutional ownership there. Anyways, sorry, getting a little bit off track here, but I guess I'll share some thoughts here. Um, First of all, I think one thing to think about is, Cybin and MindMed are very closely behind COMP360 now, it seems. We'll have to see when they initiate those phase 3 programs. Although some people might say, oh, well, Compass is working on TRD, MindMed is working on GAD, Cybin, well, also to MDD, Cybin's working on MDD. Ultimately, I've come to realize that these drugs will be competing with each other despite going after different indications. Even with CYB4, Cybin's going after GAD, but they're also looking at depression scores. They're doing that for a reason. So, I think there's something to be said about maybe a second mover advantage in the space where companies get to see what Compass Pathways is doing and the corrections that they're making and the logistical issues that they run into in trials, and they're able to learn from that, I think. They're also not too far behind. I guess we can't forget about the USONA Institute either, although I'm personally not sure how they get around the Compass patents. I guess time will tell what happens there. So to maybe end this video, I guess I would like to speak about maybe I wanted to touch a bit on Cybin running a trial in major depressive disorder. So something I've come to realize is that although Cybin is looking at major depressive disorder, we all need to keep in mind that TRD is really a regulatory term. In the real world, it's my understanding is looked at as first, second, third, fourth, fifth line treatment. So my understanding is, despite the fact that Cybin is looking at MDD, second line treatment, when someone's SSRI or SNRI is not working, that in the real world, that drug will, especially in the beginning, probably be only prescribed to people who meet the I guess what we call treatment resistant depression, which as Kabir Nath at Compass always says, is a horrible term because no one's resisting treatment. It's just people being failed by what's available. And again, to be clear, not everyone is failed by these treatments, but a lot are. And that's why it's important that all these companies are doing research. It's interesting with Cybin. A couple of things. People don't have to come off their antidepressants. I know Compass has said that they have a 90% success rate with that, but I can't help but think that that is a little bit of a barrier. Providers are sometimes hesitant or a little bit worried about having people withdraw medication, especially in a current depressive episode, I would think, at least. And that takes time too. I think it takes 4 to 12 weeks to come off. And although Compass has a 90% success rate, I'm not sure if that data necessarily shows if people struggled through it. We know that some people are fine once they come off of antidepressants or are weaned off. And we also know that some people, it's very difficult. So I think Cybin has an advantage there, looking at an adjunctive treatment in their trials, also not having to go through the hurdles of looking through documentation, getting the documentation on people who meet the criteria for treatment-resistant depression. We know that's been a struggle for Compass in the US, at least. So I guess, yeah, to wrap it all up, disappointing news, frustrating, not necessarily super surprising to me. I really like, I always tell people, I know we don't always have time to do this. I totally understand it. But, maybe instead of watching that TV show at night to wind down, watch an investor call. That's kind of what I do, because I just can't get enough of this space. It's so fascinating. you can get a lot from looking at people's body language and the way they say things, the way they word things, in my opinion. For example, Atai, people might be aware we predicted, Adam and I, that Atai would end up selling their stake in Compass. And if you had listened closely to very closely to investor calls, their wording around their stake in Compass, it made it at least obvious to me that there was a high likelihood they would sell their stake in Compass to extend their runway. And now with COMP360, the couple of weeks ago, I heard them say we're releasing COMP005 data in early 2025, potentially, they said. Maybe, that technically was still going along with what they were saying, because, Q1 2025 is early 2025, but there's room for interpretation when you hear someone go from Q1 2025 to saying early 2025 in a conference call. Long story short, watch the investor calls. I think you can get a lot from them that you can't get from reading through a press release. A lot of hidden gems in there. I firmly believe that. Anyways, yeah, I keep on saying sorry, but this is officially wrapping up here. My thoughts are, again, I'll reiterate, drug development, success in drug development is not measured in weeks or months. It's measured in years. We've seen this. I think there's something to be said about a second mover advantage in this space. This is disappointing, but I'm still just as bullish on the space as I was even last year, even before the MDMA news. But again, we'll have to wait and see these data readouts. As I've said in other videos, sometimes early phase 2 data can look very promising and looks much different in phase 3. So, it's going to be exciting to see the results we get, from Compass in the second quarter of 2025, GH Research, maybe early Q1, late this year, Beckley Scitech early next year, Cybin phase 2 GAD data. I'm very excited to see. I'll just leave it at that. I hope everyone, got something out of this video, and working on planning future interviews right now. One of them is going to be on the topic of music in psychedelic therapy, something that I think is not talked about nearly enough. So really excited to try to set that one up. I think it'll probably happen. Anyways, I hope everyone has a great day, and talk soon.